Hello, my name is Rebecca, and I'm going to be doing an assessment on you today. And just so you know, I would like you to be able to tell me what my name is at some point during the exam. I'm going to go ahead and wash my hands. Alright, the patient's apparent state of health is healthy. Can you tell me how old you are?
20.
And how tall are you?
5'3".
And do you know how much you weigh?
110.
Alright, let me check. You have a BMI of 19, which is normal and in the healthy height-weight range. Could you tell me what your race is?
Caucasian.
And your preferred gender?
Female.
Alright, dress, grooming, and hygiene are all appropriate, and I don't detect any offensive odors. In regards to mental status, the patient's demeanor is cooperative, her affect is animated, her thought process seems logical, relevant, and organized, and her speech is articulate, and the patient is alert, from what I can see. Can you tell me your full name?
Sarah Marie Roberts.
And can you tell me where you are right now?
At home.
And can you tell me what day of the week it is?
Friday.
Alright, patient is alert and oriented times 3. Do you know who the president was before Trump?
Obama.
And do you remember what my name is?
Rebecca.
Remote and long-term memory are intact. Could you explain to me what it means when I say an apple a day keeps the doctor away?
If you eat healthy, you won't need to go to the doctor.
And if it was snowing outside, how would you prepare to go outside?
With a scarf and a hat and boots.
Alright, good. Abstract thinking and judgment are all appropriate. Now I'm going to go ahead and take your vitals. I do not have a thermometer, but if I did, I would just sweep it right here across her forehead and then down behind her ear. I'm going to go ahead and take your pulse. Alright, I got a pulse of 86 and respirations for 16, which are both normal. For blood pressure, I'm going to set this right here for you. If you wouldn't mind just resting your arm right there. And if you could just hold that there for me. Yeah, seems a little tight. That's better. blood pressure was 122/84, which is in the normal range. Alright. Go ahead and move this out of your way. And are you in any pain at all?
No.
Alright. I'm going to go ahead and assess your head. Just by looking, everything looks normal. I don't see any bumps just from inspection. Go ahead. And upon palpation, I don't feel any bumps. The hair is firmly attached. The shape of the head is normocephalic, and the size and contour are appropriate. I didn't see or feel any malformations. The head and the face look symmetrical. And like I said, the hair is firmly attached. The color is kind of blonde with some orange, some darker areas. The distribution and appearance and the texture are appropriate. And the scalp is negative for lumps, bumps, and lesions. Now I'm going to assess your eyes. Just by looking, I can see the alignment is proper. The prominence is appropriate. And I don't have a pen light, so I have this flashlight I'm going to be using instead, which I know isn't really the right thing, but it's all I have for now. I'm going to go ahead and shine a light in your eye. You could just look right at me. Alright, and now I want you to go ahead and look straight back at the wall, and then when I tell you to, look quickly at the end of this flashlight. Alright, so look at the wall, and light, and one more time, and light. Alright, judging from what I saw, the pupils are equally round and reactive to light and able to accommodate. Now I'm going to test your extraocular movements. I'm just going to have you go ahead and focus on my finger for this, and I want you to follow my finger with your eyes without moving your head. Alright, good. The patient's extraocular movements are intact, and I can tell from this that cranial nerves 3, 4, and 6 are grossly intact. Now I'm going to go ahead and look at your ears. Just by looking, I don't see anything abnormal. They look symmetrical from where they're located on the face. I don't see or feel any lumps or lesions. I'm going to go ahead and shine this light in your ear. Once again, I know it's not a pen light, but it's just all I have. Alright, I don't see any drainage or any signs of infection. Have you had any trouble hearing throughout this exam? Or no? Alright, hearing is grossly intact. I'm going to go ahead and assess your nose. And if you could just tilt your head up a little bit. Alright, I don't see any drainage or congestion. Are you having any difficulty breathing?
No.
Or are you having any difficulty smelling?
No.
Alright, good. I'm going to go ahead and inspect your throat. If you could open really wide and say ah.
Ah.
Alright. The mucous membranes were all intact. They're pink and moist. I didn't see any lesions or missing teeth. I'm not going to assess your gag reflex right now, but if I was, I would take a tongue depressor and just place it on the back of your tongue and kind of slide it back until I get that gag reflex. And you don't wear dentures, do you?
No.
All right. And I didn't detect any odor. Could you swallow for me? All right. It's positive swallow. Good movement of the trachea. I'm going to go ahead and palpate that. The patient has proper tracheal alignment. And I'm going to go ahead and palpate your lymph nodes. You just let me know if there is any pain or tenderness with any of this. I have the preauricular, postauricular, occipital, tonsillar, submandibular, submental, and superficial cervical, posterior cervical, deep cervical, and superficial, supraclavicular is what I'm looking for. And did you have any pain or tenderness with any of that?
No.
Alright, the lymph nodes were all non-palpable, which is good. And there was no tenderness. I'm just going to look at your skin now. From what I can see, the flesh tone is appropriate. It looks like you may have a little bit of a sunburn here. Are you in the sun?
Yes.
Alright. And moisture feels good. The texture was smooth. I'm going to go ahead and check your turgor, which was good, and I don't see any lesions. Alright. I'm going to go ahead and assess your carotids. You can just breathe normally for this. The carotids are present and strong. I give it a 3+. And they are symmetrical. I'm going to have you take a deep breath in and then out and then hold it. Okay? Alright, they were both negative for turbulence. I didn't detect any sounds of a bruit or occlusion. For this, I'm going to have you lay down while I inspect your heart. Alright, I'm going to go ahead and assess your heart now. The first thing that I'm going to do is I'm going to look for any heaves or lifts, which I didn't see. I didn't see any pulsations. And I'm going to go ahead and palpate here. And the aortic is negative for pulsations, negative for thrills. Pulmonic is negative for pulsations, negative for thrills. Third intercostal, Erb's point, is negative for pulsations and negative for thrills. Fourth intercostal space is negative for pulsations and negative for thrills. Fifth tricuspid is negative for pulsations and negative for thrills. And the fifth intercostal midclavicular mitral, pulsations are there. And the PMI parameters, the rate was consistent with vitals. The rhythm was regular. The intensity was strong. And the diameter was appropriate. And I'm going to go ahead and listen. Alright, I heard the appropriate relationship of S1 and S2. The rate was consistent with her other vitals. The rhythm was regular, the strength was strong, and I didn't hear any extra heart sounds. You can sit back up, and I'm going to assess your lungs and thorax. I'm going to go ahead and assess the lungs and thorax. Just upon inspection, everything looks even, symmetrical. I don't see any deformity. I'm going to go ahead and palpate the clavicles, the sternum, and the shoulders. Structural symmetry is appropriate, no deformity. You could go ahead and take a deep breath in. One more. Respiratory excursion was good, and deep and symmetrical. And just by looking, don't see any lesions or lumps. Now I'm going to go ahead and listen. If you could go ahead and breathe deeply through your mouth and turn your head to the side, but just breathe no quicker than normal. Alright, the rate was normal, consistent with your vitals. The rhythm was regular. The depth was deep upon examination. The effort was non-labored. I didn't detect any use of accessories. No adventitious breath sounds. And, yeah, looks good. I'm going to go ahead over to your posterior. Just upon inspection, I don't see any lumps or lesions. I can see the patient has the appropriate S curvature. And if you could go ahead and give yourself a big hug. And the scapulas feel symmetrical and appropriate. And the spine is straight. Could just put your arms down for me. There we go. And the AP transverse diameter is appropriate. And you could go ahead and take a deep breath. And one more. And respiratory excursion was deep and symmetrical. Now I'm going to go ahead and listen. If you could give yourself a big hug and just breathe deeply through your mouth, but no quicker than normal. All right, the rate was normal, consistent with your vitals. The rhythm was regular. The depth was deep upon examination. Um, the effort was non-labored, and there were no use of accessories, and no adventitious breath sounds. Now I'm going to have you lay down so that I can assess your abdomen. All right, I'm going to go ahead and assess your abdomen now. Just by looking, I don't see any distension or pulsations. And I'm going to listen for 1 full minute. All right. I heard about 10 bowel sounds, which is normoactive. I'm going to go ahead and percuss a lap. All right. I heard tympany, which is appropriate. No dullness. And I'm going to go ahead and palpate a lap now. Tell me if you feel any pain or tenderness with any of this. And I'm going to go from light to deep. All right. That was negative for tenderness. I didn't feel any lumps or lesions. Your bladder wasn't distended, and I couldn't feel any other organs. You can sit back up now, and I'm going to assess the musculoskeletal. All right, now I'm going to begin the musculoskeletal assessment. Are you experiencing any joint pain at all?
No.
I'm going to look at her joints. I don't see any deformity in any of them. Are you having any limited range of motion, trouble moving anything?
No.
And do you ever feel any like crackles or like pops in any of your joints?
No.
All right. No limited range of motion and no crepitus. I'm going to go ahead and inspect your extremities. The color looks appropriate, a little bit of redness from your sunburn. The temperature is appropriately warm. I'm going to check your radial pulses, which are strong. I give it a 3+, and they are symmetrical. I'm going to go ahead and check the posterior tibial, which are present, strong, and symmetrical. And dorsalis pedis, which is also strong and symmetrical bilaterally. I'm going to go ahead and check your capillary refill. Which is brisk. And cap refill on your toes. Which is also brisk and under 2 seconds. I don't see any edema on any of your arms or your legs. All right, I'm going to have you grab my hands and squeeze them. Now pull towards you, and now push away. All right, strength is appropriate. If you could get up and just walk straight and then back. And you can sit back down. Her gait is coordinated. Do you have any trouble with that?
No.
Any balance problems?
No.
All right, I'm going to go ahead and test the strength in the lower extremities. If you could pull your leg towards yourself. And now push away. And pull towards yourself. And push away. All right, strength in lower extremities was strong. And are you having any problems with sensations, like feeling hot or cold or tingling?
No.
Okay, I'm going to go ahead and check your reflexes. Do that and make a fist for me. All right. All right. I'm going to make a fist and relax. Good. The brachial reflexes were present. And good. And patellar reflexes are present and appropriate. And that completes my assessment for today. And thank you for being my patient.